Hussein.
Rizki, a 5-year-old Malay boy, presented to the ED of Susmek due to rapid breathing for 1 day. The history was taken from his mother, a nurse in NICU Susmek. He was apparently well up until 4 days prior to the admission, where he started to have cough. The cough was initially non-productive. His mother denies any barking or whooping cough. There were no triggering factors such as cold, dust, or smoke, and there were also no variability throughout the day. The cough was associated with runny nose and clear watery discharge. Otherwise, there was no bluish discoloration of the face, no complaint of sore throat, dysphagia, or hoarseness of voice. He was then given a cough syrup by his mother, which is acetylcysteine, but the cough did not resolve. On the 3rd day of illness, his cough started to worsen. It developed into a productive cough, which is whitish sputum, but mother did not notice any blood streak in the cough. He also developed post-acid vomiting, about 3 episodes per day. Each vomit is about a handful, and the content is food. There was no bilious or blood content. Okay, so during this time, according to the mother, he is less active than usual, but can still play with his siblings. He had reduced appetite since he started vomiting. On the 4th day of illness, which is 1 day prior to the admission, he started to develop fever. The fever was continuous, not associated with chills or rigor, and there was no documented temperature at home. He was given suppository paracetamol by the mother at home, and the fever was reduced. On that night, his mother noticed that he had a sudden episode of rapid breathing with subcostal recession, but there was no associated noisy breathing or bluish discoloration of the face. He also complained of chest pain to the mother, but mother could not ascertain the site or nature of the pain. Otherwise, he is still able to drink, and there is no convulsion episode and no drowsiness noted by the mother. He was then brought to the ED on the next morning. So on further questioning, there was a similar history of illness at the kindergarten, where they have cough and runny nose about 2 to 3
Semula yang pasal sini itu semula history tu tak dengar.
Can you hear me? I
Ya,
think
tadi yang
my
semula
internet
history
connection
tu.
is okay. So on further questioning, there was a similar history of illness among his friends at kindergarten, where they have cough and runny nose to his symptoms. There was no similar symptoms in his family. His mother denied any close contact with a positive COVID-19 patient in the family. However, mother is unsure about the status of his friend's family. Okay, this is the first hospitalization for this child, and he has no personal history of asthma, eczema, or allergic rhinitis. In the family, the mother actually have allergic rhinitis. Otherwise, no atopy history in the family. Okay, for the systematic review, because this child has a fever, so there is no rashes, no earache, no diarrhea or abdominal pain, no dysuria, frequency, urgency, or cloudy
Tak dengar
urine.
apa history tadi.
This is for the
semula yang pasal there's no similar history start semula kat situ. Hilang sekejap tahu tak? Tak semula ha.
I try to I try to change my internet connection. Okay, is it clear now?
Tak tahu sama je. Baca lah.
Okay, so there was a similar history of illness among his friends at the kindergarten, which is cough and runny nose. This started about 2 to 3 days prior to his own symptoms. There was no similar symptoms in the family, and mother denied any close contact with positive COVID-19 patient in the family. However, she is unsure about the family of the child's friends. Okay, this is the first hospitalization for this child. He has no personal history of asthma, eczema, or allergic rhinitis, but his mother has allergic rhinitis. Otherwise, there was no atopy history in the family members. Okay, for the systematic review, because this child has a fever, generally there was no rashes, there was no earache, no diarrhea or abdominal pain.
Ya. Kenapa?
Ini dia tanya, what are the chances of kita nak suruh dia buat biopsi?
50-50. Because I'm discussing with my colleague the infectious disease dahulu. There are possibility we going to go in back. Tapi we discuss balik nanti. I just discuss dengan ENT team. Nanti we tell them what to do. Either we have not decided somebody to add paracetamol balik semula for a month or do biopsy.
And then kalau buat biopsi, it will be ENT yang akan buat.
ENT buat.
Sebab info buat ada lah probably ENT yang akan buat. Dia macam very reluctant if need to go in.
Yalah, we discuss okay that we don't know what we're dealing with. Nanti we do a conference later. Don't know what. Tapi kalau kita nak buat biopsi, we do CT scan first. We may do, tapi CT scan tu we ada kemungkinan kita buat juga, aku tahu dia. We discuss with the whole team dulu.
Next week kita akan tahu the plan.
Okay, betul.
Okay, there was no dysuria, frequency, urgency, or cloudy urine, no headache or neck stiffness, and there was no arthralgia or myalgia. Okay, for his birth history,
Finish.
Yes.
Marahaini, any question?
Aini tak dengar. Aini tak dengar.
Any question? Marahaini, mana orang ni?
Dia terkeluar.
Dah keluar, terkeluar. Dia terkeluar.
Dia keluar ke dengan cerita question tu keluar balik?
Tak sure.
She said that she cannot hear the audio. I think internet problem.
Aiman, ada questions?
He has history of similar symptoms before?
The child, is it you're asking?
Does the child has similar history of coughing before?
No.
And is the cough become worsen with at certain period of time or no?
No, there is no variability throughout the day.
Izzatul?
Is there any symptoms of TB such as night sweat and also any TB contact before?
There is no night sweat. But for the TB contact, I did not ask about that.
Fatihah.
For the fever, just now you said there is no recorded temperature. Does mother describe whether it is low grade or high grade fever?
Dengar tak? Oh, tanya.
Hmm.
I did not ask specifically for that question. Sorry.
Sazwani.
So this patient had reduced appetite during the illness. Is there any loss of weight because he become less active? So is mother complain any loss of weight for the child?
There is no reduction in weight.
Khadijah.
Did he had any history of personal atrophy?
Tak dengar apa?
Eczema?
Is there apa?
History of atrophy, example eczema.
History of apa?
Atrophy.
Atopy.
No. No personal history, and for family, only mother has rhinitis.
Najihah.
I would like to ask, from the history, there is similar history of illness among his friends. Are there any of his friends have gone COVID-19, RTK antigen test or PCR test for COVID? Or is he primarily done that?
I'm not sure about his friends, but actually when he came to the hospital, he has done RTK, and in the ward he has done PCR, but it is negative.
Oh, okay, thank you.
Islami.
During the night before admission, did the child was he able to sleep during the night?
I'm sorry, but I did not ask for the mother about that.
Rahaini.
Regarding you mentioned regarding the chest pain, can you elaborate more regarding that?
Chest pain.
Yes.
Umur budak ni berapa?
5 years old.
So the child can tell you the told mom got chest pain.
Because sorry,
Solehah.
The mother said that the child complained of having pain and just having pain at this area, at the chest area.
That's all.
Yes.
Nothing else. How the mom think how bad the pain is?
I did not ask further about that. I did not ask further about that.
Apa?
I did not ask further about that.
Further about that.
Further.
Okay, any other questions open?
Regarding the you mentioned this is the first hospital admission. did he had any similar symptoms but didn't go to any seek treatment any at GP or hospital, but he had that
No. This is the first time.
Does his mother went to clinic first, because he said that he was given suppository paracetamol, which means not available at home. So does he
the mother is actually a nurse at NICU Suspect, so she just give him on her own.
For the paracetamol, you said it is the fever reduced when give the paracetamol. How many times does mother give the paracetamol for fever to reduce?
Only one time.
Any other question? Sekejap Hello? Salam. The cyst tu bigger lah, yang micro abscess getting bigger. Memang fluid lah, macam still like before fluid. Tak berhenti pun continue. Masih lagi tengok. Dulu dah straight dah, tapi tak dapat buat ultrasound guided, tapi dapat tahu tu with small amount. Dah buat ultrasound guided dah sebelum I start buat dia treatment dulu. Tak tahulah, rasa thinking either I add paracetamol balik ataupun I do the biopsy proper. Itulah betul hantar ENT tu discuss, because dia dah touch sebelum ni, jadi the anatomy is not the same anymore. So dia touch on this, so dia orang pun rasa dia worry about the facial nerve. Because dia touch, kalau tak touch lagi tak apa, tapi dia touch dulu, 2 kali touch, so position pada facial nerve tu nak boleh clear. Second, yang mana kan first time operate yang masa datang kat sini, second time you operate kat sana. So if you it's going to be the third time. So mak dia pun masih semua dalam, masih lagi shock kejap. Tengok macam mana. Tunggu 3 hari shock lah sekejap, sebab kita rasa dia clinically going well, but gemuk dah tau. Gemuk dah tu pula tu. Itulah bila we are thinking to do, taklah. Mungkin we do CT scan balik and we go in lah tengok. Just nanti ada bincang dengan ni dulu. Sebab you punya tu, you punya kawan tu, dia complain kata yang I monitor weekly monthly ultrasound tu, dia complain because in a way no need to do, go clinical saja. Nah, even you have facility macam now kan, when we do the biotic gland ultrasound, nampak benda tu besar balik tau. So daripada you tunggu sampai benda tu timbul, for you so dia punya argument is pelik. Betul dia kata my practice not the same with your practice, I cannot advise you. Cocky lah, I think very cocky. Because your friend kan nak buah you dulu, sekejap. Something not right as a mentality. You get everything data, so what do you think about it, bukan you just make a past comment like that. Maturity lah, you mean it tell you how mature. Tak tahu pun. Even if you cannot give proper advice pun, you see we discuss tau. We discuss what's your opinion, my opinion, everybody opinion tau. Macam Nick he give nice opinion on those things. Oh, sure. Tapi dia cuma dia tak suka kerja kuat. I hantar kes ni ke dia pun, dia kata tak apa, tak payah lagi lah, dia hantar nanti kadang aku. Yeah. Tapi he able to give me a good. He able give me a good advice. Oh. He kenal Nick. Good advice. Good advice. I start this case. Agak dia marah, ada send this to earlier to her because he say if you want to send, you can send now. Sebelum mula discuss with her, and then she say apa tu can send earlier, nanti apa tu don't you send lewat, nanti kita orang kena buat benda-benda yang nak clean up your problem lah, macam tu maksud dia. Tapi it's not easy to ask the parent to send early, bukan parent nak pergi sana pun. COVID and all those things tau, dia dengar. Then furthermore, it's just a discussion, discussion is such that I think management still the same. Dia suruh restart balik everything. Siapa? Hello. Dengar, tak fikir macam mana jadi macam tu. Dengar. Apalah jelas. Apa pasal sedemikian? Apa pasal sedemikian? Even yang junior pun kita cakap macam tu. We discuss the case. Sekolah jumpa teknik macam mana? Kita bincang. Tapi CTMI kalau nak buat, kalau you decided to proceed for ni, if you decided to proceed for betul, dulu dah ada dah CTMI tu. Decide you, dan if you decided to proceed for biopsy, tak macam mana? Because saya tu, itulah yang profesional. Dan budak sihat gemuk lah. Gemuk lah. Benda tu lah. Siapa? Datang masa dekat yang dekat sini dulu. Tak ni lah saya tak mungkin tak datang masa tu. Okay. Ya. 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 Okay. Okay. Ya lah, adalah dengan kita butol dalam 4 bulan dah. Pening kepala dengan tu. 4 bulan, tapi itulah Nik beritahu dia pernah kasi sampai 8 bulan, 10 bulan. Artinya apa? Dia betul. Itu betul lega sikit ada nak. Cek tu apa? Cek tu simptomatik lah. Perlu 4, 1, 3 oksigen lah. Nanti akan kasih you protokol balik kalau you pun. 1, 2, 3, 4. 1, 2 tak masuk, 3, 4 masuk. Yeah. 3 perlu. Kita take 3 biasa. Dia tak lagi lah. Sekarang itu polisi takut orang sudah tahu vaksin. Kenalah faham kita ni sebab sekarang ni kan because the only way to only people come for vaccination is fear factor. Sebab because kan vaccination kan is ni, so dia fail to mount good PR. Dia do proper PR, so now they use a fear factor. Nampak macam mana? Because you are too late. By the time the anti-vaxxer dah mounted counter, you tak counter balik. Ya. Tak ada counter kan? As a result, they use fear factor. Okay, thanks. Any other questions?
I have question. Do the cough is exacerbated by increase in activities? For example, like running.
No.
I would like to ask about the fever. As you mentioned earlier, the fever is reduced by paracetamol. However, upon arriving at the emergency department, is the child is still feverish?
I don't ask specifically at ED, sorry.
I would like to ask, does patient have previous episode of similar symptom before?
No.
Is the patient complain of changes of voice or choking or drooling of saliva?
No hoarseness of voice. For choking and drooling saliva, also no. And patient have no sore throat or dysphagia.
Okay. Faiz, how about the shortness of breath?
Sorry, how about shortness of
How about the shortness of breath?
shortness of breath is severe because of the rapid breathing and with subcostal recession, according to the mother.
Itu saja.
And then he also has a reduced appetite.
Lagi? How much appetite reduce? You think very reduced, slightly reduced?
I'm not sure. I think just slightly because he still can drink and can play.
You think what?
I think mine.
Izatul, how about the shortness of breath? Izatul.
I think at the shortness of breath is mild to moderate in severity because it was associated with subcostal recession. However, there is no noisy breathing or bluish discoloration.
Lagi? Sazwani.
I think it is severe because patient had rapid breathing and subcostal recession.
Yeah. Hello. Negatif. Jangan cepat dia dua sampel. Satu sampel I hantar ke ni, satu sampel you all ambil. Tak tahu jadi sampel you ambil. Sampel yang I ambil tu I hantar ke gene spurt negatif. Itulah ada is kita we don't know whether we Bobsi, yes. Ada gambar tu, gambar tisu tu yang ambil. Ada lah. Tapi mula nobody thought it's a TB because by the finding like that, HP dia. So nowadays because kita tak ada, masalah ni kita tak dapat apa tu the TB itself lah, itu pada biopsi saja. Biasanya kan gene expert ni kalau benda tu mati pun you can detect PCR tu, because dia alive or dead also you can detect. And then masa gene expert tu kita buat kan, masa tu benda tu dah besar balik, biasanya expert tu kita nampak visible cyst dekat parotid area tu. Yes. So now we ini problem lawa dah dia itu. Dua kali. Kalau kita buat MRI kan, is there going to have anything or not? Tapi sebelum buat tu you need MRI dulu kan. Dia nak cyst tu je. Tapi it getting bigger tau yang last ultrasound tu. Ya dah, dia last ultrasound nanti you baca nanti bila Azan key in dia punya finding. Dah ultrasound tu, the micro abscess tu become bigger. Itu that's why we have there are the case we ultrasound dalam apa case kalau apa benda yang boleh dapat apa tu cyst apa tu boleh besar kecil dan cyst boleh ada kan in term condition. Ada condition tak macam tu? Parotid cyst yang boleh besar, boleh kecil, boleh besar, boleh kecil. Ya. So I prefer is we get proper tissue. Tidak berapa lama nak tak antibiotik. Dia patient datang anytime je, tapi kita kena make up our mind dulu. Kita kena discuss dulu with ourselves, go through everything semua everything, all the output, everything semua. I'm worried also dia pun tak dapat benda yang benign. Lepas tu budak tu ada palsi, pening kepala. Benda tu benign. Kalau benda tu dia ada way kan, biar benda tu besar betul-betul lebih cyst tu bagi je. Bila ada cyst, we observe biar the cyst to getting bigger. You see the cyst getting bigger or not? Bigger, then kita go in. Tak confirm, tapi dia punya HPE dia ada dia ada sel apa tu? Bila buat dia punya HPE tu memang quite specific, because dia fairly specific lah PTB. Tapi you still want, kalau boleh the germ tu itself nampak AFP, you want to see the ni, because HPE ni depend pada siapa yang baca. Tak, jadi dia depend siapa yang baca juga. Siapa yang report tu, you dapat yang very senior group people report different. Kalau dapat yang kadang patologi baru ni dia tak sure tulis apa itu. Tapi TB tapi yalah, tak ada sangat, tak kongsi sangat. Lepas tu TB ni pula TB kan, TB ni you body pula satu benda lain pula. Benda tu dekat dengan otak. Just nearby to the otak je. Boleh migrate easily ke brain, satu hal kerja lain pula. Ada susahnya jadi doktor. Malas jadi doktor semua sekarang ni. Dah tahu dah 4 bulan dah hitam buta tau. Budak 4 bulan hitam buta boleh dibuta tahu tak? You tahu tak? Kadang-kadang tak tidur malam. Okey, budak tu 4 bulan hitam buta, tahu tak? You tu, tapi dia sebaik siapa tu this my colleague dekat KB kata tak apa, dia pernah pakai sampai 8 bulan hitam buta. Dia cakap, ya ke 8 bulan? Sedega dia dengar tau. Tapi you yourself rasa, oh my god, 4 month hitam buta, budak ni anytime boleh blind tau. And then I nak pergi nak switch hitam buta ke Fadzil pula. Nantilah thinking ni aku bincang dengan kulit kat sana. Mungkin kita switch hitam buta ke Fadzil tengok macam mana. Aku tak tahulah. Aku talk to parent kalau your child blind, don't sue me lah. Cakap dia betul, cakap dia because the longer you wait, the longer they can become blind because of hitam buta. Dan furthermore, I worry tiba kan all of this kan, tiba benda tu something benign saja lah. Then you see not worth it to start anti-TB for so long like that. Tiba benda tu actually nothing benar. So well. Gemuk dah. Betul mak dia happy, mak budak tu gemuk. So the only way to solve the problem is to get what is it really. So what is it really? Yeah. Nanti saya bincang dulu lah. Very well, I think semua. Kalau dia ada pulmonary TB sekali senang juga. Susah lah tiba-tiba yang you katalah suddenly yang you tak optimal the treatment, tiba-tiba 1 bulan ni pasti datang fitting pula. Benda tu migrate to the brain pula. Satu kerja lagi, one more thing, headache sama. Kalau benda tu dalam tulang tak apa, usually it won't migrate anywhere. Tapi protein ni tak tahu, it can migrate to the brain. Masa on treatment lah benda tu makin besar tu headache. Kalau benda tu respond on treatment tak apa. Dan kita have not seen those who partially respond like this tau. All my kids and children when TB macam ni difficult pun when we start the treatment they just respond. TB. Dulu dia ada satu abscess yang besar tu. That's why your the cyst connected tu. Then you yang visible at the parotid region tu. That's what you aspirate lagi tu. Tak ada apa kan. Tapi masih kali buka that time pun ada satu yang besar tu, yang connected to the external. Macam tu lah. Ada siapa yang expert kat Malaysia ni bahagian-bahagian macam ni? Your friend di ANT. Tanya. Siapa? Dato. Jika Dato Z boleh juga. Ya Dato Z bincang Dato Z nanti semua mungkin refer ke dia kalau dia boleh buat. Refer ke dia. Because benda tu besar balik. Waalaikumsalam. Okey. Siapa tadi? Isilmi, what you think? How severe is that? No, so you faham betapa busy ni doktor ya? Tak faham sebelum ni. Biasa doktor ni tu macam lecture dekat dekat UIA, duduk dalam bilik, lepas lecture balik, tak ada macam tu Kita tahu dalam doktor, dalam ni, satu kes pun can give you headache sampai berbulan-bulan. Iselmi
I think it is severe because the patient have rapid breathing and also having subpulmonary recession. However, the patient have convulsion and also drowsiness.
Yeah, mild, moderate, or severe.
Moderate.
Because moderate.
Because the patient have no convulsion or drowsiness.
Why it cannot be mild?
Because the child has already had rapid breathing and also subcostal recession.
You buka Khadijah, buka tu assessment of severity. Ini respiratory ni. First, the child breathless. Baca dulu orang tu. Buka.
Nak buka dekat mana, Dato'?
Ada di protokol lah.
Nak tunjuk dekat skrin ke? Nak tunjuk dekat skrin ke?
Pardon?
Nak tunjuk dekat skrin ke? Ke saya yang baca?
Baca.
Okay. So assessment of severity in pneumonia for age 2 months to 5 years old, there is a three classification.
Look for the severity of shortness of breath.
Bukan surat?
You're looking for shortness of breath. We don't have diagnosis yet. This case, do we have diagnosis?
No. Not yet.
160.
Apa?
Oh tak, untuk surat untuk SOV. Tapi ni bawa asma.
Okay. Nanti severity of acute asthma exacerbation.
Tak apalah, dia sama je assessment apa tu, dia punya severity of shortness of breath. Mal apa dia kata?
Okay, for mild, the patient able to breathe when walking, able to talk in sentence, alertness may be agitated, respiratory rate is normal to mildly increased, absent use of accessory muscle, they may be wheezing but moderate, and then SpO2 on air is more than 95%, pulse is less than 100 per minute, and PEFR is more than 80%.
Moderate.
For moderate, patient is breathless when talking, but for infant having feeding difficulties, patient able to talk in phrases, patient usually agitated, increased respiratory rate, there is present usage of the accessory muscle, there is loud wheezing, the SpO2 on air is 92 to 95%, pulse is 100 to 120 per minute, and the PEFR is 60 to 80%.
Severe?
For the severe, patient is breathless even at rest. If infant, the patient is stop feeding. Patient is able to talk but in words. Patient is usually agitated. There is markedly increased respiratory rate, and there is presence of usage of accessory muscle, but more severe compared to moderate. And there is usually loud wheezing. The SpO2 on air is less than 92%, and the pulse rate is more than 100 per minute for more than 5 years old. But for infant, it's more than 160. PFR is less than 60%.
So what do you think?
I think patient is moderate.
Moderate.
Because patient is
apa patient tu ada? Baca balik. Mula apa?
mula-mula breathless when
Salam.
talking.
Iza, boleh tak on
But this was
you arrange for IGRA for this young? IGRA. Dia tak nak buat IGRA lagi kata. Sebab I mungkin nak discuss somebody di Australia, kat Australia sana. I nak buat everything ready. Okay ha. Dia sebut dia negatif dah. Nak buat IGRA. Okay ha. Mula apa? Baca yang pertama, parameter pertama apa?
Restless.
Breathlessness, budak ni breathlessness macam mana?
Ikhlas.
Level of breathlessness. Daripada history, berapa?
I think Dato. Itu macam
Khatijah, apa breathlessness dia? Level ni? You dah dengar history kan?
Kalau moderate, ada tapi
moderate apa?
pasal SOP dia when
tak,
talking.
this case, forget about the ni. Sekarang this case, breathlessness dia ada macam mana? On rest, exercise, apa on this case? You listen the history dah kan?
Yeah.
What do you think?
I think tak ada mention pasal breathless while talking or exercise.
Okay, lagi kedua?
Tapi exercise there is no. Tapi while talking tu saya tak.
Second apa? Second parameter?
Yang kedua talk in.
So budak tu?
Talks in
this child, this patient?
I think tak mention juga.
Ketiga?
Yang ketiga alertness.
Alertness.
Usually agitated.
This patient?
I think not agitated.
You think not agitated? Is agitated or not agitated? Or normal?
Yes. Not.
No.
Normal because.
Solehah, agree. You present this case.
I think my history on this part is lacking.
Pardon?
I think my history on the SOB severity is lacking.
Kenapa nak aku salah sekarang? Why you feel guilty now? Sekarang answer the question. Do you have about this patient agitated, not agitated ke, lethargy ke, pun history, tak tahu.
No lethargy. Mother just said that no confusion.
No confusion.
Not sure about agitation.
I'm
not sure about the agitation.
Tapi Khatijah dah decide dah, no agitation. You yang present unable to decide. Khatijah tak present, dia decide dah. Next, apa lagi?
Next is the respiratory rate increase. Respiratory rate increase.
Takib discharge, takib ni. Okay, lagi?
Second is the usage of accessory muscle.
Discharge using accessory muscle kan? Lagi?
Next, wheezing. Wheezing.
Pardon? Tak dengar?
Wheezing.
Wheezing tak relevant because the child probably we don't know yet the diagnosis. Tiga, apa lagi?
SpO2.
SpO2, SpO2 berapa kat A&E? When the child came to A&E, apa SPO2 dia?
I did not get the result at the SPO.
You didn't get the result, or do you ask the mom about the SPO2?
I didn't ask the mom. I just get SPO2 on
So you
examination.
see the history is not very clear yet, is it? That's severe. Perhaps looks like moderate, tapi the other parameter you don't have it yet. Suddenly the child really agitated with subcostal accessory muscle or saturation just 92%. They're already in the severe phase. You don't know. Fatihah, what is the essence of the case? This is the first time I take you all, kan? Okay, what is the essence of the case?
For the essence of the case, this patient, a risky 5-year-old boy, presented with worsening cough.
No, Marhaini, what is the essence of the case?
For my this case, this patient had risky 5-year-old boy presented with worsening cough for 4 days.
The risky 5-year-old boy presented with rapid breathing for 1 day.
For
1 day.
So the child is what? Having shortness of breath for
1 day.
This 5-year-old boy who having shortness of breath for 1 day. What the next thing come to your mind? So we discuss already. Aiman, what the next thing come to your mind?
Severity of the shortness of breath.
Izatul. Sazwani.
Mm.
5-year-old boy who having shortness of breath, acute for 1 day. They the essence of the case. What the next thing come to your mind?
Underlying medical illness.
Medical illness. Apa underlying medical illness?
With no underlying medical illness associated
So
with
they have
subpasteurization.
The associated symptoms for diagnosis.
You are a doctor. Khatijah. Ui, teruknya. Dia orang group lain pun dapat juga dah fikir.
Patient current condition. Patient current condition.
Fatihah.
How about the shortness of breath?
We dah discuss already that one. Apa lagi nak discuss? Now we go to the essence of the case dah.
Is it the diagnosis?
Any cardiological problem?
Astaghfirullahaladzim. Teruknya your group.
To manage this patient.
Macam mana you jadi doktor ya? Mentality tak go, you know, you are not a doctor mentality. This is 5-year-old boy who having shortness of breath for 1 day. Apa the next thing on your mind is what is the
Diagnosis.
What is the cause? You tarik W inside your mind, tahu tak? What, when, how. If you have W in your mind, your mentality is investigator mentality. The first thing running to your mind is what the cause? Because your job is to find the cause. So what the cause of the shortness of breath in this case? Can you think back? Kenapa you cannot think like that? Why is it you unable to think like the investigator in brain? Basically, you can police ke apa ke, dia tengok berdarah. What the cause of the bleeding? Dia tengok orang kena tembak. Oh, mati. What the cause of death? It's basically investigator brain tau. Why is it you cannot go that basic level of thinking? What is the cause of shortness of breath? Okay, your job is to solve the patient problem. Can you solve the patient problem if you don't know the cause? You cannot. You have to know the cause if you want to solve the patient problem. Is it so difficult? So what is the cause? But in order for you to identify the cause in this patient, what the first you must have? You must know already the knowledge inside your brain. Something you have to have inside your brain. Tutup ni, dia tutup letak ear pun boleh answer my question. This is a thinking process. It doesn't need year 1, year 5, year 3, year 4. It is the way you think. The way you think logically. Because what makes your life easy and difficult as a doctor is not how much you know. It is the way you thinking. The way you thinking will determine you can have a easy life or difficult life in medical field. So what the thing that you have to have, if you want to solve the causes of shortness of breath in this case, what the thing you must know? Anybody?
Can we divided the causes based on symptom?
Yeah, it is the answer. Before that, you have to know all the possible causes of shortness of breath in this patient 5 years old. You have to know all the possible causes. How you want to diagnose something you don't know? If something is not inside your brain, can you diagnose it? You cannot diagnose it. So you have to know all the possible causes of shortness of breath in this case, before you can identify the causes of shortness of breath in this case. So where you can find the list of causes? Where you can find it?
In books.
Books or
Internet.
Nowadays the knowledge at your tip of the finger. Even books pun you can get the books inside the e-books lah. That's the reason why you want to read the book. Read the internet. The reason is you want to get the knowledge so that you can solve your patient problem. If you get the knowledge to pass the exam, you get the knowledge because you study your patient. Mana lebih banyak, lebih lama you akan dapat, you lebih ingat.
Study the patient.
Because you can remember your patient. Now tell me the possible cause of shortness of breath in this case. Buka lah internet you tu. Google kan, ataupun kalau ada buku tu buka buku. Shortness of breath in this age, what are the possible causes? Letih mengajar you all ni. You all ni balik ke third year, balik semula level you all. No, level you may know a lot than your colleague year 3, tapi the thinking process you all ni is jatuh balik ke year 3. Siapa nak baca proses?
So the cause of shortness of breath can be divided based on the system. So I choose two system, respiratory and cardiovascular. So basically for the respiratory, it can further divided whether it is upper airway or lower airway. So for the upper airway, it's possible caused by any obstruction by foreign body or there is inflammation at the upper respiratory tract. But for the lower airway, it can be caused by the same as foreign body or obstruction by the caused by COPD or asthma. But if there is parenchymal problem, it can also lead to rapid bleeding. For example, like pneumonia or pulmonary edema. Okay. And then for the cardiovascular cause, it is whether by there is acute heart failure with pulmonary edema, or there is pulmonary embolism, but it's less common for children.
Okay, Fatihah, is it possible the child is having heart failure?
I think not, because this patient does not have any comorbid.
You see, it didn't come, your thinking process, You see, talking about the patient asking the word heart failure, what the thing come to your mind? Should be. Because you're thinking situ saja tau, mati situ je. Tapi you cakap heart failure, what the thing come close to your mind?
Congenital heart disease.
Pardon?
Congenital heart disease.
No, I ask a question to you. We're talking about heart failure. What the thing should cross to your mind?
Failure symptoms.
The sign and symptom of heart failure. I ask you a question, cross your mind or not? Bila we discuss heart failure, if it doesn't cross your mind, memang mind you memang tak memang not you ready yet to become clinician. Your colleague mention about heart failure tu, otak itu compare to the history of the patient dah. You nampak tak cara you fikir tu very superficial. I'm not talking about, I'm talking about, I'm assessing your way of thinking, you tahu tak? Sekarang I tengok look each of you, how you all thinking about the case. Macam mana proses otak you to thinking about the case. You see, if you have a good thinking, even kalau kita ada tak banyak case pun, discussion semua, you dah ready dah tahu. Because otak you terus tahu, heart failure they got decreased effort tolerance, you got a cough, decreased effort tolerance, generalized edema, generalized edema, lepas tu the child will have the octopnea, PND, all the symptoms heart failure, tahu tak? Lepas tu sign cardiomegaly, hepatomegaly, all those things tau. And then you will start compare with the history yang your colleague present. Ada ke tak ada? If you don't have that kind of thinking, you balik muhasabah balik semula. You go back and thinking muhasabah balik semula, cara you fikir. You going to suffer jadi houseman. Benda ni common sense je. Common sense ya. You dah tahu thinking. Your group tak dapat tau. I think one of the worst group. Tak dapat. Ada group boleh juga cakap, oh, this case kalau sign symptom, oh, dia tak ada decrease effort tolerance. Ni tak ada. You tak boleh fikir in terms of sign symptom. Okay, then later on cakap lah, oh, they will not known to have heart disease. Tak ada known to have heart problem before. Tapi that is not as important as the sign and symptom. Why is it your brain cannot go a bit deeper in thinking process? You can tanya pada you all. Benda tu senang je. Ilmi, is it foreign body or not? Injection.
No.
Why you don't think foreign body injection?
Basically, it should be. We should ask for that in the history.
Doesn't matter. Why you don't think? You thought of stupid answer tu. Plain stupid. You say no. Then I ask you why you don't think like that. Basically, we should ask the question about. You tahu tak? Your answer contradict your own first answer tau. Your current answer contradict. You don't you think stupid or not bila dengar macam tu? My God. When not you know to, I expect you give the answer. Oh, there's no history of choking. There's no history of stridor, but because they don't nosy breathing. No, you tahu tak? I expected that answer. I don't expect the answer. Oh, we should ask that. You the answer no. Kemudian you bagi answer pula. We should ask the question about that. You tak ada damn stupid answer itu, contradict your own self. But not you keep your mouth shut first and fikir dahulu. Why you want to contradict your own answer? Tak synchronize. Your first answer dan second answer. Najihah, is it asthma or not? Najihah?
I don't think it is asthma because this is his first presentation.
Pardon?
No, I think this is not asthma because this is his first first presentation. No
Okay.
prior symptom before this, and
Okay.
personal atopy such as eczema, allergic rhinitis. Even though his mother had allergic rhinitis.
Anything else? You don't think it's likely to be asthma?
The patient has no triggering factor that cause
Did it cough earlier?
Cough.
But is it cough triggering factor? Aduh, letihnya lah. Triggering factor for asthma, cough. True or false?
Due to infection.
What kind of infection? Cellulitis.
Lower respiratory tract infection.
Lower infection. Apa is the infection? So the child got upper respiratory infection or not?
No upper respiratory tract infection such as runny nose, sore throat.
You agree with that, Solihah?
Sorry.
No, patient has runny nose and cough.
Patient have?
Patient has runny nose.
You see, you know why is it I can do a lot of things, but I can notice that. Because in my mind, when patient comes shortness of breath, I already list the possible causes already. When my mind already lists possible causes, when I know what I want to look from the history. For look history, the child got URTI, runny nose, runny nose, the child got URTI, probably this trigger the shortness of breath, asthmatic attack. Or child got runny nose first, then the child after tracking down the infection become bronchial pneumonia. I already know because membrane will listed all possible causes. I don't listen, dengar macam tu saja. When I listen the history, I already assess the history. I already assess the history. I want to know how severe is the shortness of breath. I will decide. No, looking severe. How severe is that shortness of breath? What the possible cause? I already assess the history dah. I already assess the history. Why can't you all assess the history when you listen it? I would say, you see the weakness of you also, you don't know the basis, the point, the major point of the major illness. You know, what I mean, you benda-benda macam sign and symptom of heart failure. You have no choice but kena memorize. Sign and symptom of foreign body. Sign and symptom of, let's say, laryngomalacia, congenital heart problem. Sign and symptom of metabolic acidosis. Sign and symptom of bronchopneumonia. That one you kena hafal lah, no choice lah. You baca yang you hafal, baca yang you hafal. Then after that, when you listen to the history, you try to find the history, which one is more likely for the history, which is more, the sign and symptom, which disease that the child is having more compared to the others. Then from there you think, this is more likely diagnosis. Kalau you listen saja, listen saja, tak ada apalah. You tak assess the history. You cannot decide from the history, even in your opinion, how bad is the shortness of breath. Tak dapat. You tahu shortness of breath saja. Tapi you don't know, when you see the cases, the severity will decide your level of management. How detailed your management depend on the severity. The child need oxygen ke, the child need nebulizer ke, the child need ventilator ke, depend on the severity. Any questions? Gotta go further. So you want to go further, you must have certain thinking process. We go further. You HOPI pun you tak dapat nak go further. You are deteriorating from your third year. Even the third year pun can discuss further better than you all. Tak dapat nak discuss further. Because you're unable to analyze the history. No point we go further. Go back and think how to analyze the history. Any questions? Tak ada. Beritahu the second group hari Isnin pukul 11.
Dato, pukul 11 hari Isnin minggu depan ada
Isnin cuti
seminar.
Seminar.
Okay. Baik. Kita orang ada
dengan siapa?
Dengan doktor, dengan Dato.
Tak payah, itu buat seminar tu cuti. Isnin cuti, dah tahu ke Isnin cuti? Sepatutnya tak ada kelas.
Tapi dalam jadual kita tak.
Itu orang buat jadual tu stupid, tak tahu dia cuti.
Okay.
Isnin tu adalah hari 7 hari bulan kan? Agung Barat tak ada teaching.
Okay.
Faham? Siapa yang buat tu memang tak baca, tak tengok jadual. Barat dia empty, faham? So I nak buat teaching second group. And the third group pukul 2. Okay. Beritahu diorang semua kena prepare 2 case macam ni. I'll select which one. You're lucky. Last time you tahu tak? Each of you gonna prepare the case last time. Each of you, and I'll select which case I want. Because you tak ada face to face, I nak you prepare 2 cases saja. So I select which one. Kalau ada masa, I will take both cases. Kalau tak ada masa like this, because you are unable to progress at a certain level, 1 case only. How far you go, sampai ke history, sampai ke diagnosis, depend how far you can go at the certain level of ni. If you can pass your history punya ni critical thinking, then we go for further. Kalau I found out you still unable to go beyond the certain level of ni, we start to the HOPI only, and it's for your own good. So you tell them to prepare 2 cases. If you are good, memang ada case sampai I can go beyond sampai investigation, tapi depend how good they are in discussion on the cases. So as usual, prepare 2 cases, and then ni seminar tu semua kemudian mungkin jadual baru. You don't worry lah, jadual sikit orang kami bertukar punya. Tentang next week jadual baru. Ada setiap 5 hari jadual baru. You don't know. Sebab kita orang pun tak nak jadual sekarang. Jadual keep on changing. Tak boleh buat apa. Nak jadual is you tengok nanti, you don't be surprised another 5 days besok jadual baru balik. So that's how it's going to be. You punya exam pun mungkin akan delay lagi. Apa yang nak buat? Marah ke COVID? Buat itu orang. Marah ke COVID, marah ke apa tu? Marah kepada kenapa vaksin lambat, kenapa you dapat vaksin dah? You tak ada kat sini. You tak ada kat sini, mungkin tak ya dulu dapat vaksin for you all. Kita kan hospital going to allow your hospital become PPV kan. Hospital will be place will be vaccination. Tapi you all tak ada sini. Year 3 ada semua. Apa tak faham kenapa year 3 ada sini, you all tak ada kat sini? Yes, tak faham. I don't know why is it the final year is not here? Why the year 3 yang sini ada terbalik? As a result, mungkin year 3 dulu dapat vaccination. Kalau dia vaccination dulu, dia dulu lah face to face. Because once they vaccinated, kita boleh buat face to face proper. Okay, sebab ada cerita sebab year 5 nak balik bergaya sangat. Betul, ya ke? Year 5 nak balik bergaya. Year 2 kenapa? Year 3 yang tak galik nak bergaya tu. Year 3 pula yang tu. Year 5 pula yang galik nak bergaya. Aku pening kepala dengar. Betul ke?
Balik juga.
Diorang pun balik juga.
Jadi diorang boleh balik awal, diorang balik lewat. Kenapa diorang yang balik YouTube balik dulu?
Diorang ada face to face je sebab diorang dah habiskan teori.
Diorang ada apa?
Macam priority bagi kat dia. Diorang dah habiskan teori, so tinggal klinikal je. Tak tahulah doktor prioritaskan diorang.
Diorang ambil klinikal saja, exam. Tapi diorang dah habis. Habis exam semua dah habis sebelum bergaya lagi, dia semua dah habis exam dah.
Dia tinggal klinikal je. Maksudnya klinikal
Face to
session.
face lah.
Teaching. Face to face.
You rasa siapa yang lebih penting? You all ke year 3? Year 3 tu ada setahun lagi. Dia ada tahun depan dia ada lagi. Dia year 5 nanti. Well, right, focus to you all. Face to face ni. Year 3 you cannot wish that mess up later. Tapi you all tak ada. Year 3 dululah you vaccinated. You rasa macam mana? Fair tak? Year 3 dulu vaccinated. Dia orang tak vaccinated, dia orang free datang ke ward pasti.
Orang dah banyak dah isi tak dapat lagi.
Ya memanglah, tapi sekarang year 3 dekat sini kan. Waktu sekarang hospital, you know, sekarang university will become a center of vaccine kan. And then you know, biasa vaksin we need to call daripada 100 orang, mungkin yang datang dalam 70 macam tu kan. Jadi 30 tu usually is the Macam MU, tahu kan MU semua student dia dah vaccinate. Semua clinical student dia semua dah vaccinate dah, year 3, year 4, year 5. Sebab dia orang akan jadi pengganti. Panggil saja bubuk-bubuk datang. Tu vaccinate. UM dah habis dah vaccination dia. Dia clinical dia. UKM arti 1/3. Sebab dia orang stay kat situ. Jadi bila patient, bila kita panggil 100 orang nak vaccinate kan, yang datang 70. 30 daripada student yang datang. Sebab tu dia orang sekali dah face to face, dia orang semua dah open learning dah dia orang. UM. Tak apalah kan. Life bukan always fair kan, macam mana kan. Dia komplain pula, Dato komplain pada dia, tulis surat pada Mazuki. Jangan macam tu pula. Terimalah apa yang dah berlaku. So, kita tak boleh realize, kita tak tahu apa yang berlaku 1 week from now. Jadual pun keep changing. I pun dah tak follow jadual. For your information, tak follow jadual dah. Ada pening follow jadual. Lepas tu tiba hantar. 5 hari lagi, Farah hantar jadual baru. Tu hantar jadual baru. Akhirnya kita tak tahu mana jadual sebenarnya. So, and then we decide to do our own way. Tak apalah, you all tapi cuba dapat vaccination early. Tapi you punya exam can delay, dengar, tak apalah, don't worry lah. Ada masa lagi.
Dato'.
You all tak sambung nak kerja. Nak jadi patient tu, doktor check COVID semua. You kolek dah masuk dah kerja dah. Yang senior ni dah kerja dah kan?
Belum. Baru letak AHO.
Tak dia orang panggil awal sebab tak cukup doktor ni.
Ni panggil lambat.
Lah,
tak tahulah.
Dia komplain tak cukup doktor, tak cukup, apa tak panggil. Tak tahulah, I don't want to think about it lah. Dia, they have not enough doctor because the case are that not enough people though. You just can call them and work early, that's all. They got thousands of people outside there, you can come and work, so now they complain not enough frontliner. There are many housemen that you all yang sanggup berkorban kan, betul tak? Ya, sanggup berkorban jiwa, fizikal kan? Ya. Tak sanggup berkorban. Sanggup kan berkorban untuk negara kan? Okay. You beritahu pada tu pukul ni on Monday. Okay. Ada apa lagi?
Dato'?
Okay, sudah.
Dato'.
Ini Hilmi dia pergi semalam Jumaat lah.
Ayah saya je dapat, saya tak dapat.
Ya, you tak dapat ya. Tak dapat invitation semalam Jumaat. Tak apalah, sesama tu. Sesama lah, aku tak dapat invitation juga. Imagine, profesor tak dapat invitation tau. Dah 3 Jumaat dah. Dia ke semalam taubat besar-besar. Kena semalam taubat apa? Semalam taubat. Kena semalam taubat yang main tu. Kalau 3 kali, 6 kali, lagi semalam taubat, lagi banyak semalam taubat, lagi besar semalam taubat, kena buat lah. Okay.
Dato'.
Santiha, Dato' dah ada dah.
Aigu. Dengar je kan aku cakap kan?
Tadi sekat kau cakap. Tadi kau panggil lu macam dah ni dah.
Aduh.
Tiba-tiba panggil Is.
Sikit lah.
Iti nak pergi Zaitis ke Iti?
Sini ada recording je.
Okay.
Bye.
Tinggal kita dua je.
Saya tak keluar lagi ke?
Bye.